Need deformities in children. Today, I've started this channel really to give you information about different orthopedic problems which occur in children and in adults, and to help you to be able to take better decisions about your health. This is not a channel or forum for making diagnosis for specific individual cases. Please subscribe, like, share, and to let me know if there are specific topics that you wish to hear about or learn about. Thank you. So, knee deformities in children are quite common, and they range everything from those cute little bow legs you see in babies to those really obviously bowed legs or not knees that could occur. How do you know what to do and when to do what? Parents often have a lot of anxiety trying to answer these questions. I will be focusing this short talk as a guide, and it does not replace the need for you to see your doctor. I would be talking mostly about Bowlegs today, just to make things easier for you to follow. Please subscribe, like I said earlier, and kindly leave your comments and let me know if there are specific things you wish to hear about. So, children have a normal range of changes that occur in their knees, and this is quite easily seen. Most children are born with a small tendency to have their knees just slightly bowed, and they tend to straighten out as they get older. When should they be straight? Children should have straight legs by the time they're about 2.5 years. Now, you would have situations where specific families tend to have bowing that runs a bit longer than that. However, it is safest to ensure that you check any child who has bowed legs beyond the age of 2 years. It is just so much safer. What are the other times when you should check? You should check any child who's got bowing on one side. You should check any child who's got very obvious or very marked bowing. And you should check any child whose both legs are getting rapidly worse. These are times for you to see your doctor. If, of course, you've got an older child as well who suddenly acquires bow legs after having had normally straight legs, these are times to have a routine check. What will your doctor do? Your doctor will do a clinical exam, of course, check the bloods, and be sure that your child has got enough of the bone forming substances present. And if there are any requirements for correcting a deficiency, this will be done with medicines. What else will your doctor do? Your doctor will take an x-ray of the whole limb, and this x-ray should show you everything from the hip right down to the ankle, because bowing can occur at different levels of the limbs, and it's important to be clear where exactly the problem is coming from. A plan will also be made to either monitor your child or to surgically correct, depending on the severity of bowing and the cause of bowing, after all due determination has been done. Who may need an operation? There is a form of bowing called Blount's disease or tibia vara, which is a relentless type of bowing, which if left untreated can damage the joints and the bones of the leg and the thigh. It is fairly common in people of African descent and can occur in families. It is, however, easily spotted on serial x-rays, and it may be amenable to very simple operations to guide growth if picked up very early. Early in this case is before the age of 3. It has a very high recurrence rate and a high chance of damaging growth permanently if left untreated. It does not respond to braces, nor does it respond to medications or to any other such manipulations. Who else may need an operation? Is another form of bowing due to something called skeletal dysplasia. This is also fairly common in our environment, but tends to cause bowing which occurs very early in the development of a child and can be quite persistent. It tends to occur on both sides but can also occur on one side. It is also easily spotted on an x-ray of the limb from hip to ankle, and it tends to require formal correction to correct deformities which have occurred. Like I said earlier, to determine which of these different problems a child may have, and to separate children who do not require treatment if their bowing tends to be the sort that just occurs in families and simply resolves of its own accord, it is important for your doctor to measure the angles of your child's knees and check the ligaments, to obtain plain x-rays showing all the bones from the hip down to the ankles, to do blood tests to exclude deficiencies in the body's bone-forming supplies, and to take a decision on whether medication will be required if these blood tests are abnormal, and to take a decision to either wait or to intervene based on clinical examination and x-rays. It is very important that you make your follow-up appointments and you continue to be seen as frequently or as infrequently as is required to be sure that the appropriate steps are being taken and that a serious problem like Blount's or skeletal dysplasia is not being missed.